This video will demonstrate the use of the skilled nursing facility discharge orders. This order set essentially replaces the paper order set that you used previously. The recommended workflow is to actually perform a discharge medication reconciliation first to get your green check. Then you can start doing these orders. The paper process used to have a set of orders that were essentially admit orders to the skilled nursing facilities or the TCU or the New Hope facility. This replaces those completely. These are pre-checked, meant to make the workflow as simple as possible. The first check is admitting this patient to the skilled nursing facility. This is a certifying statement that has to be checked. You cannot uncheck that. There's discharge diagnoses. In order to choose discharge diagnoses and type them in, you have to modify this order and then use the keyboard to enter them. That enters them into the discharge diagnoses from the hospital. If the patient is going to a skilled nurse facility, they will need to be seen by a provider, either Billings Clinic Geriatric Services or the local provider. The care management can help you understand who that's going to be. Anticipated length of stay is always checked. You can choose more or less than 28 days. Code status, choose your preference based upon what the patient has previously discussed with you. Fluid restrictions if you want them. If you do not like these choices and you have a special volume that you want this patient to be limited to, you can simply erase your decision and type in whatever your preference would be. Vital signs per facility, activity orders. This has a pre-checked adaptive equipment in case your patient needs a walker. You can uncheck that if you choose to. Oxygen, Foley therapy, glucose, etc. There's lab orders that you can place for simple labs. You can choose the requested date and time, which labs you want. Off a small list, if you have more complicated ones, you can type them in here. You can choose when they should be drawn, if they're fasting, or should they be drawn at a certain symptom or sign or diagnoses. You can choose to have the results faxed to your office if you want to. The section below allows you to talk to the nursing facility in a more free text manner. For example, if you want your patient to have a first step mattress, you can choose that. If you have other instructions that you need to add, you can right click and modify and type in whatever you need to. That's just like writing it on the paper form for miscellaneous instructions. If you need to add another communication order there because you run out of these sentences, you can simply go to Add Order, search for SNF, and it's this SNF communication order. And now I can type in more instructions if I need to. If your patient has wound care needs or special dietary needs through tube feeds, these are available as well. This is the section if you need a pharmacist to complete medication reconciliation because you do not have a green check here. Choose this box and uncheck the review. All patients that go to the skilled nursing facilities do get a pharmacy reviewing the medications, and if they do not have a medication reconciliation, they will either call you or perform that themselves. They may call you to request the order be placed. You can order return appointments here, basically free typing in the text as you did earlier. If you have special requests, that's handled through the ward clerk on the floor. Additionally, there's orders the patient can call and schedule an appointment, and here's the rehab orders for PT, OT, and speech therapy. If you get a blue X, then you obviously have some sort of restrictions or detail that needs to be filled out. In this situation, I need to give special instructions to the speech therapist. Now, if your patient is ready to go to the nursing facility, you can simply enter your discharge orders as well. I'm actually currently logged in as a non-physician provider. I have filled out those orders. I do want medication reconciliation to be done. The only change that a non-physician provider has to do is has to enter a ordering physician, so these prescriptions are signed by that provider. The nice thing about this form is it converts everything to an electronic format that is then faxed directly to the nursing facility in a very legible format. Your medication reconciliation has been done, so you don't have to do the old paper form for that, and then you sign your orders. And now essentially you've discharged your patient, and the patient is going to the nursing home or rehab facility. I usually tell my patients that I only trust the computer as far as I can throw, but just to demonstrate to you how these orders are actually then taken care of. The depart process is taken care of by care management as well as nursing. Generally, they go in and print this form as part of the skilled nursing facility form, and this actually shows the orders that you just placed here. These are actually the admission orders that have an e-signature on them already. Therefore, you've already signed these admit orders to the skilled nursing facility. You've got your statements, you've got your labs and mattress issues and everything else that I just demonstrated for you, including physical therapy and occupational therapy needs for evaluation, vital signs, etc. The other thing that's very nice is I did a medication reconciliation on this patient prior to discharging them. Now, there is the special field where you can give notes for the patient, and in this particular patient I put in a note, and this is where these appear. The nursing facility gets these notes, as do patients if you discharge them home or from your office. I added this note to 2 aspirin prescriptions. For example, I only want this patient taking 81 milligrams of aspirin for the next 14 days after they're discharged, and I actually typed that in here as well, and then I gave specific instructions, then start 325 milligrams again. They've also got the old prescription on there as well, so I didn't want to confuse the patient, and I gave special instructions, only take 81 milligrams for 2 weeks, then restart the 325. The patient ideally then has some more understanding of how they're supposed to deal with this very complicated level of prescriptions. The other thing I did with this 14-day prescription here is I ended up putting in a stop date because I put in a duration for this prescription, and therefore this will eventually fall off the patient list in 14 days. There are follow-up appointments that if the ward clerk has had the time to schedule will show up on this, so the nursing facility has these available as well.